This is 9 News Now.
Tonight's health alert. Imagine having this in your line of sight all day long. This is what macular degeneration looks like, and some 10 million people in the U.S. have it. What is AMD, and are there ways to keep this age-related blindness at bay? Joining me now to talk about is Dr. Aziz Khanifar, an ophthalmologist with the Retina Group of Washington. So let's talk about what this is. What's happening? Why the black spot?
Well, macular degeneration affects the retina, which is the most important part of the inside of the eye. The tissue begins to break down, and when it breaks down, people will lose their central vision, just like in the video.
Just like in the video. Okay, and there's something that's called wet or dry AMD. People hear that a lot.
Exactly. The macular degeneration always begins as the dry type, and that's the tissue actually breaking down. 10% of the time, patients can have small blood vessels grow underneath the retina. When that happens, those blood vessels bleed very easily and fluid accumulates in the macula.
And I would think that makes it worse.
That makes it much worse. That makes people see distortion, makes it hard for people to read, hard to drive, very hard to do lots of things.
So a lot of our viewers out there are thinking, what can I do to keep this from happening to me?
The strongest risk factors for macular degeneration are age and genetics. Those two things we cannot change at all. But we can also live a healthy lifestyle. Eat lots of fresh fruits, dark green leafy vegetables, fish, nuts. Also, smokers are 2 to 3 times more likely to have macular degeneration compared to people who do not smoke.
So we've got another reason to quit smoking.
Absolutely.
Okay, what about the treatment? Is it better to get treatment right when you see the first signs?
Absolutely. The sooner, the better. If you have the dry type of macular degeneration, vitamins can be recommended to decrease the chances of you getting the wet type.
So even just taking vitamins can keep my vision better if I have this?
Absolutely. It can decrease the chances of getting the wet type. Absolutely.
Now, but there's also on the other end of the spectrum, there's some really high-tech treatments. I was reading about a tiny implantable telescope. That sounds like science fiction, but do you guys really do that?
The telescope is very cool. It's called the Implantable Miniature Telescope, IMT, and it's so tiny it can be delivered directly into the eye. Once it's in the eye, everything the patient sees directly in front of them will be magnified, and then they use the other eye for their peripheral vision. So it's really helpful at getting patients back some independence they lost because of their vision.
So there's the telescope, and there's also, I would imagine, medications.
There are lots of medications. You know, the wet form makes 90% of the permanent vision loss from macular degeneration, but the medications are great for stabilizing disease 90% of the time, and 30 to 40% of the time can improve vision.
Dr. Khanifar, thank you. Hopefully people will hear the message and get help right away.
Absolutely.
Thanks.